Great. Here we go, Vaikuntan. Question 1. Pressing challenges in medical education. In your opinion, what are the most pressing challenges facing medical education today, and how should institutions adapt to address them?
I think one of the biggest problem is the authenticity of medical education based on community needs to ensure that the curriculum is first aligned to the needs of the community. I think a lot of the curriculums are ancient, old, and being transplanted from elsewhere. So there is a need for the curriculum to be designed in accordance to the community needs. I believe that's the most important part. Secondly, we have problems with instructors or medical educators who are not really trained in education, which is not a mandatory requirement in most of the professional exams. And so, therefore, any medical educator should have basic knowledge and competency in education principles and pedagogical techniques and in assessment methods. And therefore, without these two key components, a curriculum that is community oriented and medical educators who are specifically trained in education, is the biggest problem currently being faced.
Excellent insights. Now let's shift focus. Question 2. Impact of technology in medical training. How do you see the role of technology, particularly AI and digital learning tools, transforming medical education?
I think AI is here to stay, both in terms of all stakeholders in healthcare, from the learner to the teacher to the institution to the employers in the community. And therefore, if AI is not included as part of not to understand the how AI works, but more important in integrating it in both teaching and learning, this is not going to work. Also, AI is there for even clinical practice, and therefore both teachers and learners need to know how to use AI as an enabling tool. It is not a magic wand, but it's just a tool. 2025 will be a year where AI will be integrated into the workflow, and therefore both students and teachers need to know how AI can be used in their practice. Especially in teaching practice, AI is going to make a phenomenal difference in providing customized, personalized learning for the students. And this has to be tapped by both the teachers and the students. Students need to be shown about the ethical and moral use of AI to facilitate their learning. The personalized component of learning allows for anytime, anywhere learning. The role of blended learning with the use of asynchronous learning is crucial, and therefore teachers need to learn how to use asynchronous platform to help the learner learn at any time, any place, anywhere. The use of simulation with the use of artificial intelligence, especially generative AI with voice mode, is going to make a tremendous part in helping students to practice, to simulate in safe environments, and therefore enhance their learning and competency building.
Well said, Vaikuntan. These technological advances are indeed reshaping the educational landscape significantly. Let's move on to the next question. Question 3. Adaptive learning and personalized medicine. How do you believe adaptive learning strategies and advancements in personalized medicine are influencing medical education?
Currently is not being employed, one because of the cost element of systems, especially educational technological systems are expensive, but with generative AI it is possible now for everyone to be able to access this technology. So in terms of adaptive learning, each learner is different, so using the concepts of universal design where the learning should be inclusive, to be diverse and equitable for everybody, it is important to use generative AI tools that should be easily accessible both for the teacher and the learner. Resources can be made available so as to allow students to learn at their own pace, and based on their own gaps in the knowledge, the AI can help to fill those gaps with specific knowledge that is required. This adaptive learning is going to be quite significant. Personalized learning is when it will take the learning to the student at his pace, at his demand. And this is going to help level the playing field to ensure that all students have an opportunity to be able to gain the competency and knowledge in their time and allow for more personalized learning to occur.
That's an enlightening perspective. Customizing education to individual needs could revolutionize learner engagement. Moving forward. Question 4. Collaboration between academic institutions and healthcare systems. How do you view the importance of collaboration between academic institutions and healthcare systems in shaping the future of medical education?
I think this is very important to engage stakeholders, and here is where participatory action research can help develop, design, deploy curriculums that are meaningful and useful for the community. Understanding the needs of the healthcare institutions and the community helps medical academic institutions to design curriculums that are specific for the needs of the community and the learner. And this is where the constant collaboration between academic institutions and healthcare institutions are crucial so that the academics can understand the needs, the learning needs of the individual and the needs of the community. If the community requires a certain amount of competency, then this has to be addressed. It is a dynamic process and it cannot be static. There'll be a constant evolution of the curriculum based on the evolving changes in the community. And also to the healthcare institution can see the gap in the competencies of their professional, which are the output of the academic institutions, and see the gaps and address these gaps needs to be done through a collaboration where the feedback can be given to the academic institution so that this can be incorporated into the curriculum so that they are fit for purpose in the community to conduct their studies.
Such collaboration sounds vital for ensuring relevant, community centric education. Let's move to the last question. Question 5: Future trends in medical education. Looking ahead, what future trends do you predict will shape the landscape of medical education in the next decade?
I think the future is personalized medicine, and therefore personalized learning becomes quite an important component. Knowledge is moving at a rapid pace, and it's impossible for the learner to continuously be able to acquire all that knowledge. Knowledge need not be a repository that sits in the brains of the individual, but AI. So the practice of medicine in the future will be the each individual clinician will practice with AI, not outside of AI, using it in a symbiotic way, but in a humanistic way. So the human loop is crucial, but the knowledge is so wide that they can access it anytime through AI. This practice is useful, and also to use AI to help in their practice in terms of diagnosis, recent advances, and in management. And so I think that's the future, to integrate AI, to practice with AI, to create solutions with AI, and to collaborate with AI. That I believe is the future of medical education.
Fascinating vision, Vaikuntan. Integrating AI into medical practice while maintaining the human touch could truly revolutionize healthcare. Thank you for sharing your insights.
Can you now perform a thematic analysis of the transcript of this interview?
Of course, I'll summarize the key themes from our discussion. 1. Community oriented curriculum. The need for medical curricula to be aligned with community needs rather than relying on outdated, transplanted courses. 2. Training for educators. The importance of medical educators being properly trained in educational theories and methods. 3. Technology and AI in education. AI's role in transforming medical education through personalized, accessible learning, and its integration into clinical practice. 4. Adaptive and personalized learning, leveraging technology to cater to individual learning styles and pace, making education more inclusive and equitable. 5. Collaboration between institutions. The value of partnerships between academic and healthcare institutions to create responsive, relevant curricula. 6. The symbiotic relationship between AI and clinicians, emphasizing the need for a human centered approach in using technology for diagnosis and treatment. Would you like to delve into any of these themes further?
Thank you very much for the interview.
You're welcome, Vaikuntan. It was a pleasure discussing these important topics with you. Take care.